In this video, we show how a PIP arthrodesis is operated with the shark screw allograft. A straight skin incision is made directly above the PIP joint. The extensor tendon is split longitudinally deep to the bone. Then we cut the collateral ligaments at the trochlea of the proximal phalanx. Afterwards, the dorsal and lateral exophytes are removed with a luer. Depending on the destruction of the articular surface portions, we remove the cartilage with the luer to create congruent articular surfaces, or we place two osteotomies with an oscillating saw. On the second and third finger, we place the arthrodesis at an angle of 20 degrees to each other. If the arthrodesis is performed on the fourth and fifth finger, the osteotomy angle should be increased to approximately 30 degrees. Of course, the individual angle is discussed and agreed with the patient preoperatively. During the osteotomy, the PIP joint is kept maximally flexed. If the osteotomy can be placed well on top of each other, we freshen the sclerotic bone of the joint surfaces with the tip of a K-wire or a thin drill. Again, we check the flexion position of the arthrodesis as previously agreed with the patient. Now, we insert a 1.6 millimeter K-wire coming from distal into the center of the trochlea of the proximal phalanx. The exit of the K-wire through the dorsal cortex is 15 millimeters to 18 millimeters from the PIP joint. To make it easier for us to hit this spot, we lightly drill into the bone at this point. Now, we clamp the K-wire coming from the proximal and drill it centrally, under reduction and compression of the PIP joint, into the shaft of the middle phalanx. Then we check the position of the K-wire with an intraoperative X-ray. Now we exchange the 1.6 millimeter K-wire for a 1.2 millimeter K-wire, over which we drill and cut the thread coming from the proximal side. Before we start drilling, we measure how deep we have to drill. To do this, we place the drill on the finger so that the joint is bridged by about 15 millimeters. We start with the thinnest drill, the blue one. Step by step, we approach the optimal screw diameter while drilling. Make sure that after drilling, there is a stable bone bridge of at least 10 millimeters between the entry point of the shark screw into the proximal phalanx and the PIP joint. If the bone bridge is shorter, there is a risk that it will break through. We cut the thread with the drill. We recognize the desired depth by the laser marks on the side. In this case, we decide to use a 4.0 millimeter thick shark screw cut. We rinse the canal with physiological saline solution so that the fine bone chips do not block when screwing in the shark screw. When inserting the shark screw, we make sure that the position of the two fragments is maintained and does not slip. We saw off the protruding material of the screw with an oscillating saw on the bone surface. Then we mill the still slightly protruding graft bone back to the level of the surrounding bone surface. Postoperative treatment is carried out with a short finger plaster splint made of soft cast for 4 weeks. The operated finger should not be loaded for another 2 weeks. Support is provided by occupational therapy.